All right, let's talk about ears. You know when a doctor grabs that little instrument and peers inside, ever wonder what they're actually looking for? Well, today we're going to break down the complete ear exam step by step. We'll look at the exact techniques that turn a quick peek into a really powerful diagnostic tool. And really, that leads us to the big question, right? The ear is this super complex, super sensitive place. So how in the world do you get a good, clear view inside to figure out what's actually going on without causing any discomfort? That's the puzzle we're going to solve together. So here's the plan. First, we'll get to know the tools of the trade. Then, we'll do the external exam. And after that, we'll dive inside to the eardrum itself. We'll look at what's normal, what's not, like perforations. And then we'll touch on testing hearing and balance, and finish up with some final neurological checks. Sound good? Let's get started.
Okay, section 1, the tools. It all starts here, right? You can't see a thing if you don't have the right equipment and know how to use it. Now, you might think these two look pretty similar, but they do totally different jobs. The speculum, think of it as your wide-angle lens. It's perfect for getting a clear, open view of the outer ear canal. The otoscope, on the other hand, is your zoom lens. It's all about getting that magnified, up-close look at the eardrum. And here's a pro tip, or maybe a rookie mistake to avoid. You don't use the otoscope to check out the canal walls because its own speculum can get in the way and block your view.
Technique is absolutely key here. So 3 simple steps. First, just get familiar with your otoscope before you even start. Find the light switch, get a feel for it. Second, and this is the magic move, gently pull the outer ear up, out, and back. Remember that, up, out, and back. What that does is it straightens out the S-curve of the ear canal so you can see straight down. And finally, step 3, be gentle. When you insert the otoscope, go slow. The goal is simple, a crystal clear view and absolutely no discomfort for the patient.
Okay, next up, the external examination. Before we even think about looking inside, a really good exam starts with what you can see and feel on the outside. So, what are we checking for? It's all about tenderness. You're going to gently press on 3 specific spots. The pinna, that's the main part of the outer ear. The tragus, which is that little bump of cartilage right in front of the ear canal. And the mastoid, that hard bone you can feel right behind your ear. And the reason is simple. If any of these spots are sore, it's a huge clue that could point to different kinds of infections.
All right, now for the part you've been waiting for. We're going inside to look at the tympanic membrane. You know it as the eardrum. This is where we start to piece together the real story of what's happening.
And this quote right here is just fantastic. Before you report the findings, you must create a mental picture. It's so true. It's not about just glancing in there and making a snap judgment. It's about taking a moment, observing everything carefully, and building a complete mental map of what you see. Then you can start talking about what you found.
So what's on this mental map? These are the key landmarks of a normal, healthy eardrum. It's not just a simple drum skin. You've got the pars tensa, that's the big, tight section. Then there's the pars flaccida, a smaller, looser part. You'll see the handle of the malleus, one of the tiny ear bones, and the folds around it. And the whole thing is held in place by the annulus, which is this fibrous ring around the edge. You got to know the normal geography before you can spot anything out of place.
Okay, so now that we know what a healthy eardrum looks like, we can talk about what happens when things aren't quite right. Let's get into perforations, basically a hole in the eardrum. First up is something called a central perforation. The name tells you pretty much everything you need to know. It's a hole that's located in the central part of the eardrum, the pars tensa. The really important thing here is that the hole is surrounded by eardrum tissue on all sides. It does not touch the outer edge, that annulus ring we talked about.
But, just saying there's a perforation isn't quite enough. You have to describe its size. A good way to think about it is to divide the eardrum into 4 quadrants, like a pizza. So a small one covers less than 1 quadrant, or less than 25%. Moderate is 1 to 2 quadrants. Large is more than half. And then you have subtotal, which is, well, it's a huge hole, where pretty much all that's left is a tiny little rim of the eardrum.
And this is so important. The job isn't done just by describing the hole. You have to think of that perforation as a little window into the middle ear. You've got to peek through it and describe what you see behind it. What does the mucosa, the lining of the middle ear, look like? Is it healthy and pink? Is it red and angry? That's a crucial piece of the diagnostic puzzle.
Okay, we've spent a lot of time on what the ear looks like. Now let's switch gears and talk about what it does. We're moving on to tests for function, hearing, and balance.
So here are 2 big ones. On the left, you have the fistula test. It sounds complicated, but the idea is simple. You apply a little bit of pressure to the ear canal. Now, if that makes the person feel dizzy or makes their eyes jump around, that's called nystagmus. It's a positive test. It means pressure is getting through to the inner ear where it shouldn't be. Then on the right, we have the good old tuning fork test. This is a classic for figuring out different kinds of hearing problems, a whole fascinating topic in itself.
And get this, sometimes with a positive fistula test, the eye movement isn't just random. It can create a specific pattern that's been nicknamed seagull surf. How cool is that? It's these kinds of specific, memorable signs that really help a clinician narrow down what's going on. We're in the home stretch now. The last part of a truly complete exam actually goes beyond the ear. We need to do a few quick neurological checks, and the most important one is the facial nerve. So why the facial nerve? Well, it actually takes a little detour right through the middle ear space, so any problem in there could affect it. The good news is, testing it is super easy. You just ask the patient to make a few faces. Step 1, look up and wrinkle your forehead. 2, close your eyes as tight as you can. 3, give me a big toothy grin. And 4, puff out your cheeks like a balloon. Each one of these simple movements lets you check a different part of the nerve for any signs of weakness.
And of course, a good exam is never one size fits all. You always have to tailor it to what the patient is telling you. So if someone comes in saying they've been feeling dizzy or have vertigo, you're going to add some more tests. That's when you might do something like the Rombach test to check their balance and make sure there are no red flags pointing to the cerebellum, the part of the brain that handles coordination. So let's put it all together one last time. It's a really logical flow, isn't it? You start on the outside, checking the pinna, tragus, and mastoid. Then you go inside with the otoscope to inspect the canal and eardrum. You identify all the landmarks and look for anything unusual, like perforations. After that, you test function with things like the fistula and tuning fork tests, and you wrap it all up with that quick facial nerve assessment. See, each step just naturally leads to the next.
And there you have it. That's our full tour of the complete ear examination. As you can see, it's a methodical process that builds a complete picture, from the outside all the way in. And recognizing all these signs, well, that's the absolutely essential first step. But it leaves us with the big question, doesn't it? What comes next? How do you take all of this information and turn it into a diagnosis and a plan to help the patient?